The 1980s for the healthcare environment is when things really started to change. The 1980s was the time frame when DHCP, now known as VISTA, was born. DHCP was the original name. It stood for the Decentralized Hospital Computer Program. And it didn't happen overnight, and it didn't happen in a very smooth manner. A lot of times when you go back in the history of the automation of healthcare in the VA, you'll run across references to the mumps underground. There was a clash. The field really wanted to start using computer systems, and central office, the headquarters environment, was moving too slow for the field. At that point in time, in the 1980s, everything was centralized and everything had to be approved and controlled by central office. The end result was the mumps underground was born. The healthcare environment wanted to move forward with automation a little more fast, and they started bringing in small-scale mini-computer systems and started to develop systems out in the field in the different medical centers. And sort of a clash occurred between David and Goliath. I'm using that as the storyline here. And the bottom line was a lot of folks out in the field put their careers on the line, and the mumps underground ultimately convinced senior management in headquarters that putting in the VISTA system, putting in small-scale computer systems at each medical center, moving on to what was then one of the more advanced computer languages, the MUMPS computer language, which was very efficient and worked well with CRTs and in doing the types of interactive applications that are needed in a medical center. The movement finally won out, and in 1982, the VA administrator, or Secretary Nimmo, signed an executive order legitimizing the underground's efforts and actually creating the DHCP movement or program. That's when things started to change. The ADP environment, especially in the healthcare environment, but also in the other parts of the VA, transitioned from the large, old mainframe systems into sort of the third generation computer systems, which consisted of mini computers. The healthcare environment bought into the Digital Equipment Corporation PDP-11 series of computers, small scale, relatively inexpensive, and the VA bought systems for every VA hospital in the country and created the first ever applications that formed the core of what was to become VISTA. The VA automated the patient registration process, the admission, discharge, transfer function, which handles the movement of patients within a hospital, clinic scheduling. They created an automated pharmacy package, a laboratory package, a radiology package, dietetics, and a few other things, and ultimately wove them all together into what was DHCP and deployed that at all VA medical centers across the country. This was the largest known implementation of healthcare systems in the world. The VA also implemented along with that simultaneously something referred to as the VADAT system, the VA Data Transmission System. And they didn't just put computer systems into each of the VA medical centers, they also started the process of linking all of those VA medical centers and their computer systems into a nationwide network. During the 1980s, what we saw was basically we automated every VA hospital in the country. We took hospitals like the Atlanta VA Medical Center, where I started and served as the CIO, And when I was there, when I first showed up at the VA Medical Center, they had one Apple computer in the research department. And there was a young fellow there named Dr. Kolodner, who years later became the CIO for Veterans Health, and also ultimately the National Coordinator for Health IT for the entire country. And he was down there, and he was the other person who had a computer at the Atlanta VA Medical Center. It was an Osborne computer system, looked like a suitcase, and it had a little 3-inch screen. And that's where we started. I mean, that was the environment in the early 1980s. By the end of the 1980s, we had 200,000 computer terminals located in every clinic, every nursing station, you name it, everywhere in VA hospitals across the country. We also saw in the 1980s the widespread movement of and use of office automation systems, word processing, the introduction of high-speed local area networks into the hospitals, and the emergence of personal computers, PCs. And those started to spread and slowly replace the CRT or dumb terminal workstations.